Welcome to Turnpaugh Talks. We have the wonderful opportunity to have Amy with us today. So Amy's our nurse practitioner here at Turnpaugh Health and Wellness. And I just want to start by introducing you to the community. So start with, if you would, kind of your background. I know you grew up here locally and had your own path to get where you are. So if you could walk us through how you got to where you are.
Sure. So, yes, I am local. I grew up in Mechanicsburg, Pennsylvania. I actually grew up on a horse farm and started riding horses at a very young age. So going through school, high school and all, I always thought I was going to be a professional horseback rider. And that was kind of my goal. So school at that time wasn't really a priority to me. It was more about showing horses and
focus on your career, horseback riding.
Right, exactly. So after high school, I ended up going to Florida for the winter, like everybody does that shows on a national level. And I found myself very homesick. And at that time, I had a boyfriend. It was my first long-term boyfriend. So I don't know, I was just very homesick, and I was getting up at like 3:30, 4 o'clock in the morning for horse shows. And yeah, because you have to get ready, you have to braid the horses and wash them and
talk about a stress
ride.
response.
Yeah. So I just decided that, that was something that I decided I no longer wanted to do. So I came home and kind of changed paths. I started going to hack, and I did really well. I was getting good grades, and I thought, wow, maybe I am smart.
Maybe the school thing is for me.
Yeah. So I took anatomy and physiology, and I really liked that. So that kind of pushed me in the direction of nursing. So then I ended up applying to Westchester University, and I went and obtained my BSN there. And while I was there, I started to kind of dabble in some alternative medicine as well. I had started getting interested in yoga, and actually that was in part due to my sister. She's 11 years older than I am, and she became a yoga teacher around that same time. So I started doing yoga. I started to become interested in acupuncture. My sister actually also did shiatsu, which is similar to acupuncture, but it's finger pressure. So just looking in traditional Chinese medicine for healing as well, in conjunction with my nursing program, I kind of saw myself going in more of an integrative medicine way at that time. And I thought, wouldn't it be great to work in some sort of health and wellness center, after school? But of course I came home to Harrisburg here, and I didn't really find anything like that in this area. So I went and I worked in the hospital. So I spent 14 years in the hospital. I worked at Hershey Medical Center for a while, and just did a variety of different jobs there. I worked med-surg for a couple of years, and then I had done a little bit of oncology, a little bit of neuro, ended up working in the medical intensive care unit, and then went to Memorial Hospital in New York, where I worked as a nursing supervisor and in their critical care department there. And then eventually ended up at Holy Spirit Hospital in the cardiac ICU.
So you started off, did your nursing thinking, I'm going to do something in whole body, holistic,
right.
Functional type care, and then kind of got your feet really wet and hands really dirty in traditional allopathic care for 14 years.
Yes.
Okay, which is, I know looking back, it wasn't your intention in nursing school, but probably gave you tremendous clinical acumen for the next stage of your life. So that was all not for naught, right?
Certainly,
That was really great information.
Yeah, and it was, exactly. So I learned a ton, and it was like, I got tired of working in one area. So with nursing, there's so many opportunities, and so I'd switch areas and, just trying to learn as much as I could. So, right. So I had exposure to patients who have had a lot of different chronic diseases, chronic issues, many of whom were in and out of the hospital. And that's what I started seeing. I'm like, I really need to get back to my roots and go help people prevent this illness and get them off of some of their medications. So, so I was working in the ICU at Holy Spirit Hospital at the time, in the cardiac ICU, and I decided, all right, now's the time. I want to go back to school. I never would have envisioned myself going back to school.
14 years after being out of school.
Exactly. But I took the leap, and I'm so glad I did, because I was able to find your office, and that's actually a funny story because...
Which I don't even know.
Yeah, so I had just started back in school, and I was talking to a friend.
So you're going to school for what, by the way? I don't want to interrupt you, but you went back to... You're already a BSN in nursing, so what are you doing now?
So family nurse practitioner.
Okay, so nurse practitioner. So you can do family care after this, like like a family doc, so to speak.
Yes, exactly. So so I had started in that program, and I was talking to a friend of mine about kind of my dream of working in a holistic, integrative wellness center. And she said, "Oh, well, don't you know there's Turnpaugh Health and Wellness right down the street, like literally 2 miles from my house." So at that time, I didn't know anything about functional medicine. I hadn't heard that term, and I just knew about integrative medicine. So I looked up your office, and I was like, wow, intrigued by functional medicine. So I called and said, can I come shadow? And Heather said, sure. And then from that moment on, I was sold. So so basically I finished school. I also went through some of the modules. Well, I finished all the modules through the Institute for Functional Medicine.
So that's separate. So you did your nurse practitioner degree, which is pretty rigorous. That's a pretty rigorous degree. Yeah, that's incredibly rigorous.
Difficult.
Yeah. But you did extremely well, right?
I did.
So go brag a little bit.
So yes. So
yeah.
So well, and it's funny, and so I graduated first in my class. Well, first out of actually the whole graduate class, which was like super surprising to me, actually, looking back, seeing myself.
Well, going through when you were going to be a horse rider,
right,
and
exactly.
I know that's probably not the right term, but you were like, I don't really care about school, and school is whatever. To graduating first in your graduating class out of all of the family nurse practitioners, that's an impressive journey.
Yes. So it was So if you would have known me in high school, you would have been like, no way, this girl. But I'm one of those people who's very determined. Mm-hmm. So when I was in high school, I was determined to do be the best horse professional. Right. And that's what my focus was on. So going back to school, I was 100% focused on my path and my journey. And I just feel like I'm completely aligned with what I'm supposed to do right now. Everything seems to be just falling into place for me. So it's a very exciting time.
Excellent. So that's the nurse practitioner. But in addition to that, while you're graduating first in your entire graduate class, entirely different is the Institute for Functional Medicine, IFM.
Right.
Which is, again, a lot of dedication. I know it's AFMCP, which is Applied Functional Medicine and Family Practice. That's a week-long, out-of-town intensive, right? And then there's 6 intense modules to go through,
right?
Which is no joke.
No.
And you did all that at the same time.
So I have gotten through all the modules, and there's a lot to learn, and still is a lot to learn,
right.
And it's funny because I haven't taken my certification exam for that yet, but it is one of my goals.
But you're board qualified.
Yeah. So it's funny, though. I was talking to Dr. Neely about it, of course, who's a well-respected pediatric oncologist. And he was saying, oh, yes, that was the hardest board examination that I've ever taken. So a little bit intimidating, but I'm up for the challenge. I'm excited.
I know you are. You're extremely competitive. Dr. John Neely, who spent some time in our office here, worked at the Hershey Med Center.
Right.
Again, board-certified pediatrics, board-certified pediatric oncology, said the hardest exam he's ever taken was the IFM board exam.
Right.
So, people think, it's just this woo-woo stuff. And this is the hardest physiology test he's ever taken. And he's not going against a low bar. He's going against pediatric oncology, and it's still the hardest test he's ever taken. So that's a bit intimidating. Like, this isn't going to be a walk in the park, right?
Right. So, that's on my list of things to do.
List. Right.
For sure. Definitely.
So you go through nurse practitioner, which includes, the rotations, just like you do in a residency program. You go through all these rotations, and then you wind up here. And so how has even working here kind of expanded what you see? Because there's what you learn in school, and then there's what you learn at IFM, Institute for Functional Medicine, which are huge jumping off platforms. But then how has your experience here kind of opened your eyes a little bit, or has it? Maybe it's what you expected.
Well, no, I mean, it's wonderful here. I love that we are, integrating the two, more conventional practice with more alternative therapies, the best of, and then looking at root cause as well. And I found that the patients here are very, very complex and complicated. So it's been a bit of, it's been a challenge and good learning experience for me. And, I like that. So
you
it's a
definitely love the
perfect
challenge.
fit.
So, but you can also, one of the benefits and adjuncts and wonderful platforms we have here at the office now is family care. So people can come in, they don't have to be super complex, which once we kind of built our office, or early on I built the office on just the complex patient.
Right.
What about the patient that says, I don't want to get to be a complex patient, I want to prevent being a complex patient? Right. That's an avenue for you now, right?
Sure.
So they can just come in and do what? Like be your family doc, so to speak, right?
Yes, come in and, I'll do an annual physical exam and make recommendations. We can draw some basic lab works and see if there's any areas that we can work on to kind of optimize their health. So that's another part of my training as a family nurse practitioner is prevention and, how do we keep people from getting ill to begin with? Of course, I feel like we need, being here, we have a bigger emphasis on really lifestyle. I mean, that is the way to do it. Diet, exercise, lifestyle. We can add some supplementations. And in our lab work, we're looking a little bit more in depth than the regular conventional practices do. We want to see if there's any micro deficiencies, vitamin deficiencies that just kind of help support overall health so that we don't deteriorate quicker than we should be.
Right. I know I've collaborated with you on a bunch of cases, and it was interesting early on coming from the cardiac world. And we run a pretty extensive, I know you do too, we all tend to run a pretty detailed cardiac panel here. And I turned to you and I said, what do the cardiologists do when they see this? And your response was?
My response was, a lot of the cardiologists are not running the InDepth panel that we are.
Which I was blown away by.
Yeah. I've had a conversation with a couple actually, and and one of them said, well, I'm running those, but most people are not on board with this yet. And it's unfortunate because we know the literature and research is there to support the testing and really determine, who actually should be on a statin or, who is actually at risk for developing coronary artery disease or atherosclerosis.
And sometimes that's not just cholesterol. Some people can have low cholesterol and still be at risk.
Right.
And some people can have high cholesterol and be at less of a risk.
Sure. There's certainly other risk factors that go into that as well.
So running the whole in-depth panel. And I love the fact that we now have also, this is what I want is I'm sick for whatever reason, and I pick on strep throat, and I don't know why I do, but I pick on strep. So maybe I need to see my family doc, my family nurse practitioner, my family healthcare provider. But there's such a disconnect sometimes if they're seeing a functional medicine provider who has them on a diet and maybe a couple supplements and modulating this and that, and then they go to their PCP who they're almost afraid to talk to about this stuff. It's as if they don't want to even talk to them about it. But that's important for them to know what they're doing. Sure.
Yes. I'm sure it is challenging. Some PCPs are on board and others aren't. And I think part of the barrier is, they just lack knowledge in the area of like using herbal supplementations to support health. They haven't had a ton of education on nutrition and how to help the body in that way. Conventional docs and providers are often trained on more of just treating the symptoms, going for medication, prescription medication, just kind of right off the bat.
So I know I hear this quite a bit from primary care providers who haven't ventured outside that box, and they'll say, yeah, but they're not FDA approved. Those supplements aren't FDA approved. How do you combat that, or what kind of conversation do you have with that?
Right. So most of the supplements that we use have been well researched, and they've been third-party tested. So, we use the most top-notch and most researched supplements that are out there. So, I also have access to the Natural Medicines database, which I utilize all the time. And so that tells me about the most recent research that's out there, and the effectiveness score even gives you an effectiveness score of certain supplements. And then I can look at drug interactions and all of that as well, because a lot of people are concerned about what interactions is a supplement going to have with a prescription medication that somebody may already be on. So,
and that's important to communicate to you. So if a patient comes here and you're their primary care provider, you want to know not only what medications they're taking, but what supplements they're taking. And I find a fear of many patients sharing with their primary care provider what they're taking because they're afraid they're going to get chastised.
Right.
Because, you're doing that stuff.
Definitely.
And that doesn't, or there's no research on that. First of all, as you point out, there's an incredible amount of research, but you bridge that gap saying, I can be your family provider.
Right.
And I want to know what you're taking and what you're doing.
Absolutely. It's so important. And not only sometimes are they afraid to tell their doctors, but also a lot of people don't even consider supplements as medication. But they can have, significant interactions with other medications. So it's important to know all of that up front when you're treating someone. So.
And again, you're not in the camp of you never need a drug, you never need an allopathic intervention.
Right.
Right. So talk a little bit about that. Is there times where you might say, I think you do need a medication, and times where you say, maybe I don't need a medication. Maybe you can handle this with diet and lifestyle, and maybe you can't. So you kind of bridge that gap. Walk me through a patient interaction with how, hey, my cholesterol's high, should I get on a statin? Or my blood sugar's high, should I get on metformin right away? Or like, how do you manage that?
Right. So it's going to depend on their willingness to make lifestyle changes. That's going to be the number one thing. So how willing are you to, tweak your diet a little bit, try to eliminate some refined sugars, things like that for both cholesterol and diabetic issues. And then as far as exercise, most of our patients here I found are seeking health and, are very compliant with a regimen that we put them on. So I would always want to try diet and lifestyle first and then retest their numbers and see where we are. We have some other herbal supplements that we can use in place of a statin or in place of metformin that have been also well studied, and some just as effective as those medications as well that maybe don't have the significant side effects that some people have with statins or metformin or other type of drugs like that. So it's really going to be on an individual basis. If they say, well, I'm just not interested in exercising and I'm too busy and I can't alter my diet because I don't have time to food prep, I'm willing to work with them. I mean, it's really what path do they want to go down? I'm here to listen, and I'll make recommendations and tell them what I think is probably going to work best for them, but I'm not opposed to prescribing them medication as well.
Right.
So it's really an individualized thing, and I'm here to kind of work with them.
It's a beautiful thing. I one of the common themes through interviewing all the providers is it's not just about our way. It's about taking the patient's needs and considerations and ability to do what we put them on into consideration. And so often now there's a trend in healthcare is like, well, if you're not doing what I'm telling you to do, you're dismissed as a patient. Like, instead of, how can I work with you? And I know you kind of work with the patient as opposed to, well, you're not doing this or you decide not to do that, you're out of my office.
Right.
Then they get no health care.
Right. Well, that doesn't make any sense at all.
Right.
Yeah, you have to meet them where they are.
And so often I'm finding a trend in, well, you didn't do this or you've chosen not to do that, so you're no longer a patient in my office, and collect your file on the way out. And then we're abandoning these patients to any kind of health care.
Yeah.
So what kind of cases are you seeing? So is it what you expected, like runny noses and strep throats, or are you seeing like complicated things? And what are some of the things you're seeing and managing quite effectively? I get to sit back and see this. So you tell us what you're doing.
So I'm seeing a variety of different patients. I've seen a lot of new patients who just want to establish family care.
So important.
Yeah.
To have that rapport with your family doc.
Absolutely. So I have children and their parents. I had a couple of families come through, so that's nice. And I hope, my goal is to establish a relationship with them, a nice, good, trusting relationship, and to kind of carry that throughout their life. And definitely excited.
Take care of grandma, mom,
Yeah,
daughter.
Exactly. Yeah. Yes. So it's been nice with that. And most of those people are fairly healthy, just looking for someone to do, their annual well checks and make sure they're on top of things as far as preventative tests and stuff like that.
Which I think you'll go a little bit deeper than even most of your family well checks. You're going to look, like we alluded to, that cholesterol lipid panel thing. You're going to look deeper into a lot of their, instead of just scratching the surface, you're going to be more preventative.
Yes, sure.
So looking into that.
Absolutely. Yep. And a lot of that will be, again, asking them what they're looking for. If they want, how deep do they want to go? I mean, we can certainly work with each individual person and kind of.
Sure, it's not that you don't have to come here if you want to be on this super strict, crazy exercise diet thing. You'll work with someone that says, I just want better healthcare.
Absolutely.
I'm not knocking healthcare because everybody's overtaxed and overburdened, but I think a patient coming to see you is going to feel, she gave me the time. She took the time they needed, and I'll just expand on that. Your first visit usually is how long? 10, 12 minutes?
Yeah, no. Anywhere from a half an hour to over an hour. It just depends on their needs and if they have any other issues going on. So usually a kiddo with no prior health problems, half an hour in and out.
And then if they come for a sick visit, they might not even need that long if it's a focused issue because you know them.
15 minutes we can usually do it in.
But you know them because you spent at least a half an hour with them before and you know the family.
Exactly,
right?
Yeah. So obviously that's much different than you get in your normal conventional doctor's office. So I spend a lot of my time in clinical working with different preceptors, and they did a great job, and they're all wonderful people. And
but they're
it's
limited.
Just, I can't imagine. 15 minutes, that's what you get, And if you're behind, everything's always rushed, and the documentation, and I just feel like, our patients deserve more than that. We really need to get to know them, be able to spend the time with them so that in the future, we know, what they need.
And sometimes you spend an hour with the patient, and in the 59th minute is when you get that, I need to know that about you, but we didn't discuss that because it wasn't problem focused. I'm only focused on your right earlobe because that's the problem. I'm actually going to look at everything and get the time to. And again, I know other physicians and healthcare providers, that's what they want to do. They didn't go in saying, I bet you I can do this in 2 seconds. But
for sure.
They have the best intentions. They're limited by the confines of their work environment.
Absolutely. Yeah. I mean, everybody, out there, all the providers, I'm sure they're wanting to spend more time with their patients and really getting to know them and all of that. But it's not determined by them.
Right.
So it's unfortunate. But, one of the things that I love about our process here is that we have the intake form. So we have the patients fill out a super detailed intake form about, from birth to where you are now. So anything that the patient might even think is insignificant that happened that might have an impact on their health, I mean, we're having them write that down. So we can look at it and say, well, this might be a piece of the puzzle when, they're going to other physicians, they might not think to bring something up, maybe a traumatic accident or something that happened when they were little that might be impacting their life now that they didn't think of it because it was so long ago. But
that's a really good point. I know the intake forms for you are several pages, and sometimes the patient's filling around like, why do I have to fill all this out? But it forces the patient to give full disclosure of all aspects of their health to establish everything from, again, how's your diet? What are you eating?
Right.
Is that playing a role?
Yes.
How's your mood? How's your digestion? How's your everything? We really kind of do the whole gamut. And what have you had surgeries in the past? Really a fully detailed history, but not just for, I know patients get frustrated, that's not just for medical legal purposes. You actually use that information.
Absolutely.
So it's not just, I checked the box so I can charge more because we're not insurance based. It's more, no, I want to know who you are.
Right.
Yeah.
Right. And some of those, pertinent details are in those forms. And again, they don't think twice about it, but when
you
I
do.
bring it up,
Yeah.
and then they can elaborate on it, and then you can find out more information. And, you know, I think the emotional and psychological piece is huge too. I mean, that's something we really emphasize here, is that is just as important to your health and well-being as your physical symptoms. And, you know, I think such a big piece that we bring into our health and wellness here is addressing that. Dr. Panatoni, I love that we have her on board, and that all
Our clinical psychologist,
yes.
right? But I think it starts with you, because you're open to allowing them to share that with them, as opposed to many times you go to a family health provider and you don't feel comfortable sharing. Like, you know, I get a little bit of anxiety, or they don't like the term, so they don't say I'm depressed, but you might word it, well, are you a little sad or blue some days? And
Right.
everybody is, it's okay. Like it's so you just send the message to your patients, it's okay to be you.
Right.
I just need to know who you are.
Yes.
Right. So
Yeah.
opening up that forcing them to open up that can of worms.
Mm-hmm.
So you bring in the emotional component, and we do have a full-time clinical psychologist on staff for those purposes.
Right.
But that's no good unless they are meeting with you and they're able and feel comfortable to share with you what's going on.
Yeah.
So
For sure.
Yeah, it's a beautiful thing to be able to say, I went in, I saw Amy, and I was able to share with her my stressors, my insecurities, my successes and failures, whatever it is. It's just a whole gamut.
Yeah.
So, and that's why it's not a 7-minute or 15-minute visit, right?
And I definitely, you know, I want to be that person that they can kind of unload
Yeah.
their stuff onto me. I mean, so you've got to have somebody that you can unload your stuff to.
Wouldn't it make sense to be your healthcare provider?
Yeah.
Who you want to know something about. So if you
Right.
call up on a Thursday and say, I'm having a really, really, really difficult time, I get it because I've met you before. I get it because I know who you are. This isn't my first go round with you. And we've talked about this. You didn't come in and you looked the part. You got to know the insides.
Yes,
Yeah.
absolutely.
So I also know you are kind of super intense about learning. Which is great. I mean, it's a wonderful thing. Kind of super intense about the learning process, and one of the conditions which we see a lot of here, we are in central Pennsylvania, is Lyme disease, right? So I'm going to get into it a little bit. I know we've talked with many of the providers about it. I do think it's so important because we look at Lyme disease much differently than probably you were trained before you came here, correct?
Oh, definitely.
Right.
Yes.
So talk a little bit about that.
Right. So in school, basically, we were taught about acute Lyme. You know, somebody comes in, it's bullseye rash, is going to identify it, or a tick bite. Didn't get into the testing so much. You just treat them with doxycycline if they had a rash. You can send the test out too. Of course, it's the ELISA. And then CDC says, you know, if that's negative, then there's no need to do any further testing. And it was interesting because I know that there are patients out there that suffer from chronic Lyme, and I've always known that, you know. So they did, the books and the texts and the teachers would always mention about how, you know, some people have Lyme arthritis, but there was never any talk about neuro-Lyme or any other symptoms that were associated with Lyme long-term, or how difficult it was to treat. And actually, one of my classmates had said, oh, I was just with so-and-so, this infectious disease doctor, for part of my clinical rotation, and she's announcing to the class that he doesn't believe in chronic Lyme. He says, once you're treated, that's it, and that's all they do for you. And
how wrong is that?
That is terrible. I mean, I was just mind boggled. I was like, really? I mean, how can we dismiss all these people? And now I see it. I mean, we have so many patients here that are just suffering from the chronic debilitating symptoms, not only arthritis, but all sorts of symptoms, urinary, bladder issues. I mean, it is just, it's interesting how it manifests so differently in so many people.
And they're commonly told there's nothing wrong with you.
Right.
So now you have a psychological component.
Right.
So now you have a patient that's afraid to unload.
Right.
Which takes us back to the first part.
It is really terrible. It can be very defeating for the patients.
And so if they don't have if they didn't have a psychological component from Lyme, which is common, they probably have one from their healthcare. That was told them they were so there's nothing, I know something's wrong with me. So the reason I bring it up is some recent trainings you're going to is ILADS, right?
Yes.
You're going to the ILAD seminar, which
Yep.
International Lyme and Associated Disease Society.
Mm-hmm.
So they're kind of the governing body for people who really want to get better from Lyme disease, as opposed to infectious disease,
Right.
which says there's nothing wrong with you. And to which I say, well, if there's nothing wrong with me, well, why do I feel this way?
Right.
And then the answer is usually because you're depressed, which is not the case. So,
Right.
and then I'm super proud and happy and ecstatic. Proud's probably the wrong word. I'm just happy that you're going to spend some time with Dr. Horowitz.
Yes, I'm super excited as well.
Yeah.
I've been reading his book. I think it's Why Do I Still Feel Sick or Treating Chronic Lyme.
His seventh book
it's
on
his
Lyme
newest
disease. Yeah.
book. But yes, that's been really eye-opening, and I'm really, really enjoying reading that.
More of a book, as a layperson, you could read it, but it's really geared towards a clinician.
Yes,
right?
yes, because it has all the treatment guidelines, and it's not always one clear path, and which I appreciate from him and how he explains, you can try certain antibiotics. It doesn't always do the trick. You might have to switch and go a different path, and it's really individualized. And then how he has a functional medicine approach as well, and how, sometimes adding certain things like turmeric and glutathione to help support the body heal as well. So I appreciate that aspect of it as well. So I'm super excited to be able to go up and do his training.
So you're like a supercharged Energizer Bunny learning about Lyme disease. And that course of study, I don't know that has an ending point at this point, right? So it's an ongoing, evolving world. But I can tell, because I've been in that world for a long period of time, your learning curve was super, super fast. So,
Yes.
I mean, just the level of clinical acumen was pretty spot on.
Well, I felt like I needed to be, like, I made that a priority because I was seeing a lot of Lyme patients, and I wanted to be clear on what best practice is for them because they're suffering.
Yeah.
And if I'm seeing them, I need to know what I need to be on spot and know what I'm doing. So that I made it a priority. But.
That's amazing. So, what other types of cases are you seeing now?
So I am seeing a lot of Lyme patients. Okay. I have family med patients, some other functional med patients. I've had some patients wanting to come in to help with blood pressure issues, specifically cholesterol issues, patients with migraines, GI issues. So just a nice variety of different things.
So, and the nice thing is to be able to come in to see you for my family healthcare provider, my PCP, and being able to expand upon that. So they're going to get more than just family medicine.
Sure.
They're going to get family medicine with some depth and some roots and some caring and some compassion.
Definitely.
And the ability to share and discuss and basically take care of the family unit, which reminds me a lot of the throwback doctors, right? Mm-hmm. When you would go and you knew you're probably not sleeping because grandma's really sick or grandpa's really sick or you had, your brothers aren't doing well or whatever.
Right.
Being able to dive into the depth of that. So,
yeah.
So, what other topics, this is our introduction of you to the community, what other topics would you like to discuss?
Well, I'm a fan of the gut.
Okay.
So when I started getting interested in functional medicine, of course, I started to watch YouTube videos. And what kept coming up was how important the gut is. Okay. And so that's a fascinating topic that I actually love to talk about. Just the different, how many different bacteria we have in our body.
So we're doing, I'm interrupting. We're doing the Spring Summit April 25th and 26th. And I'm super excited to listen to your lecture. And I know it's for physicians, but it's also for the general public. So what's your topic on?
So it is all on the gut microbiota.
I can't wait to listen to it. I can't wait to be educated by you. So tell me, what types of things does that involve?
So basically I talk about, so the microbiota is basically the bacteria inside your body, and then the term microbiome is the bacteria inside your body and all of the bacteria's genetic information.
So I was fascinated the first time I learned that 90% of the cells inside of our body are bugs.
Right.
They're not even human.
Right.
And 99% of the DNA inside of my body is bug DNA. It's not even human
Yes,
DNA. So,
I know.
yeah,
Well, that's what got me. I'm like, well, geez, I need to learn
I'm more
about
bug than
this.
human. Right. So anyway.
It's pretty incredible. So these little bugs, there's about 1,000 different species in our digestive tract. They make vitamins. They help modulate our immune system. They make neurotransmitters. 90% of our serotonin in the body is actually made in the gut, and I think about 50% of dopamine is made in the gut as well. So it has a big impact on our mood and our disease states. They've found, actually, there are more and more research is being done right now, but different health conditions such as diabetes, there are specific populations of bugs in the gut for patients who are diabetic versus healthy. Same thing.
Fascinating. Something that that's not a metformin or a glucophage. That's a bug in your gut.
Yes.
So why is this so dysregulated nowadays?
Well, there's a lot of different reasons. So the GI tract is first colonized with these bugs at birth. So vaginal birth versus a C-section birth. We know that babies born vaginally end up with a more robust microbiota with a bigger diversity of bugs in their gut that represent more like a woman's vaginal flora. And those who are C-section babies actually have similar microbiota to skin flora. So, and what we also know is those now, there's been lots of studies done, those patients who are born via C-section end up having more health complications throughout life. They have higher rates of asthma, higher rates of different immune problems, autoimmune diseases. So, that's the first way that you colonize the gut.
So first seconds of life, whether I had a vaginal birth or a C-section, will determine what colonizes my gut, right? And the preference is to get vaginal flora.
Right.
I know a midwife, if the baby was a C-section, she would swab the mom's vagina and shove it in the kid's mouth.
Yeah,
I mean,
so that's vaginal seeding.
Yes.
That's the term for that. So, and there was actually a study that was done. It was just a very small study, and they found that those babies who had the vaginal seeding, the C-section babies who got the swab, the vaginal secretions and the microbiota, actually retained those bacteria in their guts for up to actually, I think it was just a month that they tested them afterwards.
But I think, isn't it true you can tell, like in you and I right now, whether we were C-section or vaginal birth based on our microbiome?
I'm not sure, actually, because the other huge thing that impacts it is diet. I mean, that plays a role. You can change your microbiome within 6 days, they've been shown. There may be a few bacteria that you're lacking throughout life. I'm not exactly sure if you're a C-section baby. I mean, you colonize early, so.
So tell me how diet plays a role.
So, yes, it depends on what you eat. Somebody who eats a vegetarian diet versus somebody who's more of a meat eater will have completely different bugs in their gut. As primary, they're going to have different populations of the bugs. Or even somebody who lives in the city versus somebody who lives in the country has a different population of good bacteria versus more pathogenic bacteria.
Does this play a role? We sterilize our food so much by using pesticides and herbicides. Does that play a role in our microbiome?
It absolutely does play a role. And the other thing is if we're not eating organic meats, a lot of those cows and livestock are eating foods that have been, or the animals are getting antibiotics as well. And then they're eating foods that aren't, GMO and have been sprayed with pesticides as well. So that all plays an impact on your microbiome.
So if I take an antibiotic that kills bacteria, it seems that it would probably kill some of the bacteria in my gut as well, right?
Absolutely. Yeah. And clindamycin kills good bacteria for up to 2 years.
2 years?
Yeah. So
a simple clindamycin is a 2-year exposure.
Right.
So, wow. So, again, not to say that you should never take an antibiotic. That's not what I'm saying. But, wow, what an impact you have to think through. And I think, again, going back to family health care, they're like, oh, just take this antibiotic. What's the big deal? Well, it had a 2-year impact on my gut. which has a 2-year impact on my mental well-being and my immune system.
Absolutely.
That's fascinating. I can't wait to hear your talk. I'm
yeah.
super
So I
excited.
have it's a little bit more in depth with all the different types of bacteria, which ones are good and bad and more pathogenic. But
certainly something we should be aware of. And again, I don't know that that's terribly aware. I think it's becoming more aware in the medical community, but
definitely.
yeah.
Yeah. So the other thing you can do for good gut health, you can use probiotics, but I always just encourage people to eat foods that are rich in probiotics, such as sauerkraut, fermented foods, kombucha, kimchi, miso, those types of foods. So that's actually the best way to really colonize your gut, is to try to incorporate those foods.
Probably the way we did it for thousands of years.
Exactly.
Right? So that was, of course, we didn't have antibiotics thousands of years ago, but yeah.
Right.
So the microbiome and gut health, and I think you've helped us or educated us on how the microbiome or the gut health impacts inflammation in your immune system. If you're chronically sick, maybe your gut's not working right. If you're chronically depressed, maybe your gut's not working right. So it doesn't even have to be, my gut's fine. But if your gut isn't fine, like maybe you have gastroparesis or you throw up every now and again, and you probably gut is playing a role in more than just your gut.
Yes.
So
for sure. So I always start with the gut, because I think, you've got to fix the gut before you can fix anything else. If you're eating something that's inflammatory, foods with pesticides on them, or you have antibiotics, that breaks down, or even gluten's a big one. It breaks down the mucous membrane on the inside of the gut lining, and then your gut becomes leaky, and it's only held together by, it's one cell layer thick. So you have your bugs and then your mucus lining, and then you have one cell layer that separates it from the bloodstream and the lymphatic system and your immune system. So, when stuff starts seeping out on digested food particles, your body picks it up as a danger. It doesn't know what it is, and it starts to mount an immune response. So then you end up with a more systemic inflammation, and eventually that will lead to chronic disease if you do not fix it, tidy it up.
Yeah, it's a common theme I've heard from all the practitioners is gut health. Gluten is a big buzzword I've heard, and an inflammatory diet. Tell me just briefly, what is an inflammatory diet look like? What's an inflammatory diet?
So, I'll use gluten to start. Okay. So gluten is very difficult for our bodies to break down. We actually need 8 different enzymes and 6 or 7 different bacteria to break that gliadin down, as the protein in the gluten that's so difficult. So that, when we're not able to break it down, it becomes inflammatory. Other things that are hard for people to digest because they're maybe lacking enzymes or bacteria to digest them, some is corn and soy and peanuts. Dairy, a lot of times, is difficult for people.
So it seems like an awful lot of work to break down my gliadin and gluten. Mm-hmm. So if I cut gluten, I'll ask you the same question I've asked a lot of people. If I went gluten-free, if I just didn't eat gluten, and I made no other changes to my diet, what's the health impact negatively? So no gluten in my diet, what am I missing? Is it like an essential piece of my building blocks? I need my gluten to be healthy?
No, you don't need gluten at all.
So I don't need gluten. So taking it out of my diet really doesn't have a health implication other negatively.
Not just taking out gluten, I would say no. Okay. I can't think of any negative consequence of that.
Okay. So there's no harm in it.
No.
But there may be potential impacts to it, not because you have celiac disease, but because it's inflammatory.
Right. Yeah. So interestingly, I decided to eliminate some inflammatory foods when I started here.
So if I can ask, to be intrusive, a little HIPAA violation here, but what were they? What foods so just for the general public, you didn't do it based on a smattering of tests, or maybe you did, I don't know, but you did it as an anti-inflammatory diet. So what did you choose to cut out of your diet?
Well, a lot, actually.
Okay.
So I primarily ate meat and vegetables and avocados and sweet potatoes. So I eliminated all nightshades, all grains. We call it the autoimmune paleo diet here.
Okay.
And then, so gluten, corn, soy, peanuts, any sugary or processed foods, any food additives, eating all organic meats and vegetables, and then the nightshades and grains and beans.
And a nightshade is like what kind of foods?
Tomatoes, potatoes, peppers, eggplants.
Okay. So, and how did you feel? Did it make it
good.
different? Yeah.
Yeah.
Did it feel different at all, or?
Yeah, I did feel good. My husband noticed a difference too.
So he did along with you, right? He's
said,
eating what you're eating.
I really like this new diet for you. Yeah, maybe not so, sometimes I get a little fiery. When I'm tired and stressed out. Yeah. Everybody does. But a little bit less of that, a little calmer.
You feel a little calmer. You feel
a little happier.
You always seem happy. I don't know.
Well, it's funny. Yeah. So I've noticed now that when I eat gluten, I'm a little bit
quicker.
More fiery.
Fuse is a little shorter.
Yeah, exactly.
So it's for you, the biggest impact you noticed was neurotransmitter or brain
and my shoulder. So I've been having shoulder problems on and off for about 2 years. I still enjoy doing yoga. And I was doing some very intense yoga a couple of years ago, trying to do forearm balances and all sorts of these tricks and things, because I like to challenge myself and push myself. And I hurt my shoulder. I didn't go and have a workup or anything, but it was just, I thought, well, I probably, strained it. It'll be fine. And then every time I would go to do yoga and get into down dog or, do chaturangas where it's kind of like that push-up motion, it would cause pain again. So I was getting very frustrated. I tried massage and acupuncture and anti-inflammatories and heat, and it just seemed like, it wasn't getting better. Like it would get better temporarily, and then I would try and do yoga again, and then I would aggravate it, and then I'd have to take a break again. So when I went on this diet, for a month, I decided I'm just going to take a break and not do any yoga. Then I started up again, and I'm back full speed ahead. I have no pain in my shoulder at all.
That's impressive.
So, yeah, super exciting because I hear that from patients a lot, that the minute they eat gluten again, their joints, they can feel it right away. And now, I'm living that. I understand that.
You live, and it's so great that you can say, I'm not asking you to do something I haven't done myself.
Right,
like,
exactly.
I've done this.
Well, that was exactly why I wanted to do it as well, because I knew it's difficult and challenging sometimes, but if I was going to recommend it.
But you didn't do it to get rid of your shoulder pain. You did it to relate to patients.
Right.
Again, your dedication to your patients. Like, I'm going to be dedicated to my patients, and I'm going to do this for you. Wow, I really did it for me.
Yeah. Right. So I didn't feel horrible prior to doing it, but I felt better afterwards.
I have a patient when the patient had we talked about Lyme disease, had a bullseye rash on his right upper arm, and had Lyme disease. And when he eats gluten, the bullseye rash comes back. Wow. Every time he eats gluten, the bullseye rash comes back. And again, that's in your head. That's not true. You can't fake a bullseye rash.
Right.
And it takes a picture of it, and every time. So gluten drives inflammation, which mimics Lyme disease just from him eating it. So diet's incredibly important.
Yes.
So that's I am super excited to listen to your talk, and I want to do more podcasts with you about specific topics. So we might do a podcast just on like the microbiome and specific strains that help. I know you've dug pretty deep into this strain of a probiotic might be helpful for this condition, and we might be able to educate the community a little bit more about what might be right for you instead of just go getting a probiotic, because there's a lot of misinformation about just take a probiotic or just eat a yogurt. It might not be that simple. Yep. We might dig into that a little bit more, especially after I become educated at your talk. We'll do some more of that. Is there anything else that you wanted to discuss out here? So
I can't think of anything else.
I'm super excited. Can't wait to have our next podcast and learn more at your presentation at the symposium. So
thanks
so much. Yeah, thanks so much for coming in today, and I appreciate it.
Sure. Thank you.